When the borders open in WA, many people will need to self-isolate for a minimum of 7 days. If you are from a low-risk category, you will be allowed to self-isolate at home. The EDICT team has put together a guide from the officially provided information about how to get yourself and your home ready for isolation and what to do when isolating at home. When isolating at home, you'll be given a diary to check your symptoms daily and will be contacted by a nurse from the Public Health Service to discuss these. You need to have the following simple essential items in stock at home: a thermometer to be able to keep track of your fever, pain relief medications such as paracetamol and ibuprofen. Please note that these are the only 2 medications you need to help with managing the symptoms of COVID-19, and you shouldn't take anything else unless recommended by a health professional. You should take your regular prescribed medications, of course, and make sure you have stock of those at home. Disposable surgical masks are good, hand sanitizer and soap, surface cleaning and disinfecting products, and disposable gloves. The most important thing to remember when self-isolating is to stay at home. You should not leave the house for any reason except to access urgent medical care. And even then, you should wear your mask, you should call ahead, and you should let the medical centre know you are coming and that you are under isolation requirements. To keep yourself and the members of your household safe, you should stay in a separate room with nobody else. This includes any pets. Where possible, have your own separate bathroom and toilet. Make sure that the room you choose is well ventilated, for example, with windows which open outdoors. If you're unable to have a separate bathroom or toilet, you need to make sure that you flush with the lid closed and disinfect every surface you touch after every use, including sinks, taps, shower walls, etc. You should try your best not to use common living spaces, and if you need to use them, make sure you follow all precautions, including wearing masks, washing or disinfecting hands, covering coughs and sneezes, and cleaning and disinfecting all surfaces you touch. If possible, the infected person should have their own separate plates, cutlery, utensils, linens and towels, and they should wash all of these themselves to minimize exposure to other household members. Please remember that there are no visitors allowed to your home while you are in isolation, not even to meet with other household members. Only medical or emergency staff should be allowed in if necessary. Any food or groceries should be delivered to the house and left outside by the delivery person. Another good idea is to reduce any clutter from in and around your house and room. This will minimize the number of items, objects, and surfaces which can become contaminated. Being in isolation can be a daunting and stressful experience, which is why it is important to also look after your mental health and well-being during this time. Here are a few things you can do to feel well during self-isolation at home. Have a daily routine. This could be as simple as showering and getting dressed every day, having fixed meal times, and spending a regular time reading a book or something similar, some scheduled time for movement. Create an exercise routine. Anything to make sure that you are not just spending the whole week in bed in your pajamas watching a screen. Keep in touch with family and friends via digital sources. You could telephone, email, SMS, video calling, and social media can all help with this. If you're a part of a community or religious group, you can keep in contact with them. Perhaps you could attend an event online or listen to a sermon via Zoom or another video service. Use this time to try new things. Perhaps you've always wanted to try knitting or sewing or craft, reading, writing, drawing, yoga, meditation, dance. The options are endless and there's lots available online. If possible, spend time outdoors. If you have access to a private garden or balcony, spending time there in the fresh air will help greatly. If not, even standing by an open window and looking out into nature can help you feel better. Remember, if you think you are struggling, don't be afraid to reach out and ask for help. These are some phone numbers you can call if you feel you are not coping. This has been a home self-isolation guide by the EDICT project. For more helpful, more detailed information, tips and resources like this delivered in your language, please send your name and contact information to us via either of these contact details, and be sure to include your preferred language. Thank you.